All right, a very good morning to you. It's good to see you right here on Your World on this very important day. And this is as far as World Polio Day is concerned. And we'll be taking a special focus. And this is as far as a healthier future for mothers and children. And like I said, it's a very important day to, first of all, remind us that polio is still here. Okay, and there was a time right here in the country where we were talking about, yes, we have eradicated polio. Polio is no longer with us, but again, here we are, okay? We have seen a number of, and especially a few counties here and there that have been, you know, sort of like marked as hotspots, I want to say. So then that means the risk is still here. So what is it that we need to do to, you know, keep the virus at bay? So you want to stick around as well until the end of the show to really understand what polio is all about, and especially for those generations most of them might not really know what polio is all about. But listen, every year on 24th October we observe World Polio Day to raise awareness of the importance of polio vaccinations to protect every child from this devastating disease, and to celebrate the many parents, professionals, as well as volunteers whose contributions make polio eradication achievable. But the big question is, how do we strengthen these areas that, you know, we have seen a few cases here and there? How do we strengthen the same? And what is it that we can do, our individual roles, to make sure that we kick polio away? Remember, there was that time, you know, where we had that campaign, Kick Polio out of Kenya, all right? So what is it that we can do as a people? So my very able panel, and I'm happy that we have, we'll be having two polio champions here with us today to really help us understand the role that they are playing to pass the message out there. But on my immediate left, I have Lillian Mutua, who is the Nairobi County Head of Health Promotion. Good to have you, Lillian. Thank you so much for your time. As always, not the first time that we have Lillian on set today. And we also have Mr. Joseph Ndegwa Wangoi, who is a polio champion from Nairobi County. Good to have you as well. Thank you so much, Joseph, for joining us this morning. We also have Wairimu Njage, who's the district governor nominee, Rotary District. Is it 9212?
It is 9212.
9212.
Yes.
Good to have you,
you
as well, because again, your immense contribution towards the fight, you know, in ending polio. So we really, really appreciate your time. And we're also expecting Rahab Akiringa, who is a polio champion, again, from Kiambu County. But before then, let me just start with you, Lillian. First of all, polio. Like we said, we have heard about it. We might know a little bit about it. Again, for some people who, like we said, generation SI might not really understand polio and, of course, the impact that it has. So do you want to just take us through what that is, and then we'll talk to you as far as the global efforts in eradicating polio. But let's start with you, Lillian.
Thank you so much, and good morning. Polio is a disease that is caused by the polio virus, and we have 3 types of the polio virus.
Okay.
That is type 1, 2, and 3.
Okay.
And globally, we've managed to minimize the spread of polio type 2, apart from countries like Pakistan and Afghanistan, where it still is. And we know that in Kenya, we've gotten certification of being polio-free.
Okay.
But because of imported cases from outside the country, we are still seeing some incidences. The problem with polio is that it's a disease that is only vaccine preventable.
Okay.
It has no treatment, it has no cure. So in case one has not been immunized or has compromised immunity and they get the polio disease, it cannot be reversed. So once it affects you, you'll have disability, either of the lower limbs, that's the legs, or the upper limbs, that is the hands. And in cases where it affects you and the virus gets its way through the spinal cord, you will certainly die because it paralyzes. So if it gets its way there and goes to the brain, you will have to lose your life. Mostly the children are the most affected, but because their immune is not yet stable, it is not yet strong. So most of the time you'll find children who are below 5 years are at risk. And that is why when a baby is born, the first day, and for those who are born in health facilities or hospitals, we ensure that the day of birth, they get their polio, first polio dose.
Okay.
that which is called the polio, birth polio dose.
All right.
And saying that it affects children mostly does not say that as an adult you cannot get. So adults also can get polio.
Okay.
It doesn't have a race, it doesn't have age, it doesn't have, we can't say it affects more men than women, but polio is real.
Okay.
Yes.
All right. And I'm happy that you pointed out, listen, polio is real and there's so many things that we can do. You said it is vaccine.
It's only vaccine,
preventable.
Yes.
So again, and like we said, there is that recommendation as far as the vaccine schedule is concerned, which we'll talk about more on the same, because we've had campaigns, and especially from the Ministry of Health. Finished the second?
We've just finished the second round.
Yes.
In 10 counties.
Round.
Yeah. Second round for Kiambu, Kajiado, Nairobi, and Garissa.
All right.
But for the other 6 counties, they've just started their first. So the 4 counties are way ahead, because we already have reported confirmed 8 cases of polio in Garissa, at Dadaab within the refugee camp.
Yes. All right.
Yes.
And then some of these counties, just in case someone is you know, asking, so what are some of these counties? So we're looking at Machakos, Kajiado, Garissa, Mandera, Tana River, Lamu, Nairobi, Kiambu, Kitui, and Wajir. And I'll come back to you to understand why the specific counties, Lillian. But let's get a global overview. And we know Rotary has been, you know, very hands-on as far as supporting, you know, efforts from government, and of course, in this case, the Ministry of Health as well. And this is as far as eradicating polio. But on a global scale, how much of a concern, how much of a burden is polio?
Well, let me just start off by outlining that District 9212 covers Kenya, Ethiopia, South Sudan, and Eritrea. And it is part of Rotary, which is an international organization that brings together volunteer leaders to solve the world's pressing problems, both globally and locally. And on a global level, polio, eradication of polio is our flagship and signature program, which we began looking at in 1985, and over the past 35 years, we've mobilized efforts around the world to do so. And to date, we've mobilized over $2 billion in eradicating polio. We vaccinated almost 3 billion children. Because it is a debilitating disease, as Lillian has mentioned. At the global level, we're also members of the Global Polio Eradication Initiative, which is a public-private partnership led by national governments, but which brings together partners such as Rotary, UNICEF, and others. We're a founding partner, and we continue to focus very heavily on eradicating polio around the world, and working very closely here with the national government to do so.
So what are these trends that you have seen? Because again, like you said, Lillian said type 2, is it type 2? A polio that we as a country, we've been declared polio free, but still, you know, again, like, and we'll talk about borders and, you know, how do we increase surveillance, you know, around our borders to prevent, you know, onset of such cases. But what are some of these current trends that maybe, you know, you have realized in conjunction with, you know, the health ministry and, you know, champions like Joseph, as far as polio is concerned? What are some of these trends that maybe we should really, really think about?
I think it's really, that's a very good question, Lillian, and it's really because of the sustained vaccination and immunization campaigns that we've been able to reduce cases to just about 99.9%. And as you've heard, only 2 countries really have cases, Afghanistan and Pakistan. Africa was declared polio-free several years ago. So if we relent, it will come back, and that's really what unfortunately what has happened. Around the borders, that we have had a resurgence of cases, which is why we're back again supporting sustained immunization across the country.
I see that.
Yes.
I see that.
Yes.
All right. So Joseph, let's go all the way back. Okay. At 4 years old, you contracted polio, and it was not easy, not only for you as a child, but also for your family. So can we go back to Riddick Temple? 4 years old, ukiwa na miaka 4, unaweza kumbuka, you know, during this period, what was happening? Ulikuwa aje? Hiyo ni family.
Asante sana. Wakati nilipata polio nikiwa na 4 years, unajua sasa ni kuanza kuzunguka, kustruggle. Unajua sasa, unajua hata madhangu wako kwa anajua kama ni polio, sababu sikuwa nimepata faki. Sikuwa nimepata chanjo.
Yeah.
Ndio problem hiyo ilitokea. Unajua inakujaga tu, unasikia mwili inaanza kulegea, alafu unakufa mwili pande moja na pande nyingine. Alafu saa hii ndio unaonaga sasa, ukiendelea hivyo sasa mzazi ndio anabaki na shida, sababu unaona tunafanya hii kampeni, sababu hii kitu ikitokea mzazi ndio, especially mama ndio anawashwa, sababu unajua saa zingine bwana anajipea shughuli sababu ya hii janga kutokea. Sasa una struggle na your mom tagu. Najua hata hawezi akaenda mahali kutafuta kitu, sababu lazima waachwe na wewe akikuangalia, akiandika msichana. Sasa unaona msichana naye aweza akakutuza vile mama angekutuza, na ndio unaonaga saa zingine unaona hiyo polio ikitokea kwa familia hizi kubwa, wanawachaga hao watoto na wasichana wa kazi. Na msichana wa kazi aweza akamtuza vile huyo, sababu saa zile unakaa sana, unajua mwili inashoka, unaganda mwili yote karibu. Lazima kuwe na unafanyishwa mazoezi kidogo, ama unatafuta kliniki, utakuwa ukiendaga massage, such as things. Unaona hizo vitu ndizo zinafaa. Huyu mtoto akipata chanjo ndizo apate na ampewe na mzazi wake. Sasa usipopea mtoto hiyo maneno yote, unamkosea sana. Na ndio unaona tulikuwa tunasema, wacha hii mtoto, usikataze mtoto apewe chanjo. Unajua kuna watu ukataza. Especially gated community. Unajua wakipata hao watoto wako na nini, wanawafungia kama nyumba. Watoe watoto wote nje, sababu huyo mtoto unamnyima haki yake. Wacha kumweka kwa nyumba. Na ukimweka kwa nyumba, unajua kuna vitu zingine utokea kwa mwili. Especially unajua sasa sisi mwili inashikana yote. Kama mimi unaona vile unaona, siwezi nikakaa kwa nyumba. Sababu saa zingine lazima jioni nipitie gym, nichukue tu chuma kidogo ya kufungua mwili michipa. Sababu michipa uchikana. Yenyewe inakuwa shida kubwa sana ukipata polio. Sababu kuna ile unaweza patwa ya spinal cord. Ya spinal cord, unajua saa zile unakaa chini mwili inashikana na huko. Unaweza pata vidoda na huko chini, saa zile kama una mtu wa kukucheche. Na hiyo inaleta madhara kubwa sana. Wacha tuone vile tutasaidia watu ili wapate ile kitu inafaa.
Okay.
Vile unaona vile mtoto akipata chanjo, mama ndio anakuwa na shida ile kubwa sana. Sio baba, sababu unajua baba, unajua yeye ni kuangalia tu vile mambo inaenda. Akiona kikizidi sana, anatoka anaenda.
And hivyo ndio ilifanyika na wewe.
Hivyo ndio ilifanyika.
Baba alienda akakuacha na mama.
Si ndio hiyo ilienda hivyo.
Alafu you interact sana na watu because you're polio champion, si ndio? Ni nini watu wanasema sana about either kukosa kupatia watoto chanjo, ama ni hawajui about polio? Shida kubwa ni nini kabisa enye umeona huko kwa ground ukiinteract na watu?
Shida kubwa ile nimeona na watu, unajua wengine hawaamini. Lakini wakiniona vile niko na nikiwaelezea hivi, mtakuwa wao watoto wenu wanaweza kuwa kama mimi. Unaona wengine wanaole sana. Na wanatoa watoto wao. Unajua like hizi vijiji hazina problem. Sababu watoto wale wadogo ndio wanaletaka watoto. Shida inakuwa huko kama ni Isli, gated community, lakini kwa vijiji hiyo inakuwa sawa sana. Sababu hata wakiniona hivi wanasema hatutaki mtoto wetu akae kama huyu. Na ninafurahiaga sana nikifanya hiyo kazi with the passion.
Ndio usaidia watu wengi.
Ndio tusaidia watu wengi.
Lilian alisema it's vaccine preventable, so tupatie watoto chanjo, tupunguze madhara ya polio, si ndio? Lilian, this 10 counties that we've talked about here in the country. What is it? What is it about this county that, you know, the ministry sort of like put a pin on all of them and said, listen, we need to focus on these counties as far as vaccination is concerned. But it doesn't mean that all these other counties, you know, are safer. It's because we have that inter-county, you know, we travel from one county to the other, the same way people travel from one country to the other. And that also, you know, increases the risk. But what exactly is it about these 10 counties?
So we've said the incident reports that we've gotten for confirmed polio cases. Yeah. The first case was picked in May this year in the Dadaab refugee camp. Yeah. And the camp has a host community, which is Garissa.
All right.
And then we must look at the counties that most people frequent to and from with Garissa.
Okay.
And also when we followed up the cases that were confirmed positive, they originated from Somali.
Okay.
And we can't say that we are going to close our borders to our Somalian brothers.
No. Yeah.
When they're coming here as refugees, they're coming because of need, either insecurity or anything else that has happened. And in countries that are at war or are not stable, their health systems are also not stable.
True.
And that is why most of these children will come unvaccinated. And in the refugee camps, there is also surveillance and there's also screening for any child who has not been vaccinated to get vaccinated.
Okay.
As much as we have the posts where these people can go through, we also know that they pass through other porous points in the borders.
Sure.
So to track them easily is not that easy. And the people who are in the camps and within the host communities, they are sensitized that when they have people who are here as migrants, they should report so that screening is done.
Okay.
And so that these people can be put in the camp to await legal papers to be in that camp. When we look at Nairobi, Nairobi is a transit county, both as a nation and also internationally.
All right.
So we have a lot of people coming in and coming out.
Yeah.
When we look at the burden of children who are below either 1 year, 2 years to 5 years, Nairobi has the highest burden of children.
Oh, wow.
When other counties are doing vaccination for the under 5 in terms of hundreds of thousands, Nairobi we are doing 1.2.
Okay.
Or even in any other campaign we do for under 5, we do more than 1 million.
All right.
So you can imagine the number of children that we have.
Yeah.
So Nairobi is obviously a risk county.
Yeah.
If anything happens in another county, you will find it in Nairobi.
Absolutely.
And that is why we have to do this. And when we look at our neighboring counties, that is Kajiado, Kiambu, and Machakos, people come and work in Nairobi, sleep in Kajiado, Machakos, and Kajiado.
Yeah.
People work in Kajiado, they also
And
sleep
then
in Nairobi.
Sleep in Nairobi. Yes.
So that is why our neighbors are included. When we look at other counties like the Tana River and Lamu and Wajir and Mandera,
Yeah.
you can see that network between Garissa and those counties. So we need to look at that.
Yeah,
Yes.
absolutely. All right. And like we said, it doesn't mean that just these 10 counties, that's it. There's
Yes.
more that needs to be done to also extend the programs to the rest of the counties as well, because like we said, we better prevent this, right?
And also when
Yeah.
we look at our immunization coverage,
Yeah.
for children who have completely finished their schedule for immunization, the routine immunization, which the baby gets the lastly as the measles 2 vaccine at 18 months. When we look at the vaccination coverage for routine immunization, we are in some counties we are not doing well.
Very well. Absolutely.
And
Yeah.
especially after the COVID pandemic, counties didn't do well.
Yeah.
So if today, as a nation, all the 47 counties, we were doing at 95% of routine immunization coverage, we wouldn't go for a campaign.
Yeah.
So we go for a campaign because we know we have gaps.
We have gaps. All right. And of course, the big question will be, so then how do we
How do we close
those
the
gaps?
gap?
Exactly. But we'll also, remember during COVID-19, there's a lot of concern about vaccines, and especially in Africa, right? There was hoarding, of vaccines and all those things. So, and I'm asking this to to understand, so what is the role of, you know, not-for-profit organizations to come in and support, and especially when it comes to vaccine accessibility, because that has been one of the biggest challenges, and especially here in the country, like we said, there's a bit of inequalities because one county is doing very well and then another county is not doing so well. So then how, you know, do guys like you come in to support that? But we'll also talk to Joseph as well as far as, you know, his role in this is in sensitizing the people as far as polio is concerned. So much to cover. On the other side of the break, stay with us. If you have any question, send them our way at NTV Kenya, both on Facebook and on X as far as polio is concerned. We're coming back with so much more. Stay with us.
New Sensodyne Repair and Protect with Deep Repair. It's a huge game changer for me. The science is pretty amazing because it really goes deep inside the tooth and repairs tooth sensitivity. I am a happy patient. I will be able to go back to the things that I enjoy eating the most. The science is there. It's going to improve the quality of my life in a big way. The new Sensodyne Repair and Protect with Deep Repair.
My name is Norman Mudibo. For me, Man Cave really came at a very opportune time. It offers a platform for men to really open up. I've attended both. The first one was in Karen, Nairobi County. The second one was in Limuru County. And of course, looking forward to the third one, which will be in Kajiado County, specifically Oletipis picnic site. It is a safe space. Come, share your story. Inspire other men. Inspire the boys who are coming up. Inspire the men folk to really open up, to share, and to help each other grow to the next level.
What is it? There's going to be an automotive crisis soon. And it's going to hit us quite hard.
I'll see if I can come up with a solution that will make everybody happy.
But keep this in mind. I will not allow our family to be broken apart.
Oh, darn. Yes, Grandpa. Could you forgive me and forget those bad memories?
But I
want to be a better person, Natalia. Please help me.
What are you doing here, Diego Cáceres? Natalia already told you that she doesn't want to see you again.
This is Rodrigo, Mother.
Oh, Rodrigo.
Right.
Well, that's even worse. Get out of here.
Head over heels.
Head over heels in association with Ariel.
Mi hupata clean and fresh results kwa mwosho mmoja tu. Ariel ndio siri yangu. Sasa stoli yangu iko popular sana.
Ariel, usafi bora kwa mwosho mmoja tu.
Candace, what's that?
I brought you a small bonus.
Bonus for what?
You got us 299 family dinners, 64 kisses on the cheek, 12 road trips to see grandma, 42 jokes from daddy, 49 laughs from mommy.
In over 60 years of dealing with numbers, we've learned that the numbers that matter the most to you are the ones that matter the most to us. NCBA Bank. Go for it.
All holders are notified to report and surrender unclaimed financial assets to the Unclaimed Financial Assets Authority, UFAA, on or before November 1st, 2023. Visit www.ufaa.go.ke and get started.
Alright, welcome back. The show is Your World, and today is World Polio Day. And like I said right here on the conversation, we're taking special emphasis, and this is as far as a healthier future for mothers and children. Because if you were with us during the first part of the conversation, Joseph, who is a polio champion from Nairobi County, said, you know, when this happens, it is the mothers who majority of the times are left with the children. And of course, they will suffer the most in terms of making sure the child is okay, but also being able to provide, you know, what the child needs at the end of the day. So then how do we change this so that we don't only see moms, struggle with the children, but us as a community in general, first of all, embrace these children, offer them as much support as they can, but also support their families as well. So Rahab is here. Rahab has joined us. Rahab Kiringa, Kiambu Polio champion. Good to have you. Thank you so much for making the time, Rahab. But I just want you to share a little bit about your story. Let's go all the way. 1971. At 1.5 years old, you got sick, right? So do you want to take us back to those days? Joseph Alitombe, at that time, there was no much conversation around polio and, vaccines as well. But let's hear a little bit about your story.
Okay, thank you so much for having me. I'm sorry, it was a bit late.
It is okay, you're here.
It's the jam, yeah, Vika Road.
Yeah.
My name is Rahab Kiranga.
Yeah.
And I'm from Kiambu County, Gatundu South. I'm the champion, Kiambu County. And I happen to have acquired polio at the early age of 1.5 years.
Yeah.
I was able to walk at the age of 7 months, as my mom tells me.
Yeah.
And one day she came home from the coffee plantation. That is where she used to work as a cashier laborer.
All right.
And found that I was down on flu and fever. So she decided to take me to the nearest hospital, which is Gatondo Hospital. And when she took me to Gatondo Hospital, she told me I got an injection. And when I tried to stand, I couldn't.
Okay.
So she realized I could not stand. I kept crying, so she carried me back home. But when we got home, I could not even sit. So she realized there was a problem. She took me back to the hospital. And at the hospital, that is where they realized there was a problem, and they referred me to Kenyatta Hospital. And at Kenyatta Hospital, I was diagnosed with polio, and I got paralyzed from the hip downwards.
Okay.
So from there, everything changed. And when we were discharged, we went back home, and my dad could not take it. And she was told, now your girl will be like this for the rest of her life. And she thought that was not fair, and she could not live with a disabled child.
Okay.
So me and my mother and the other sibling, because those days they used to get us in 1 year's time.
Yeah.
So kila mwaka,
Like
after every 9 months, kuna mtoto. So we were 3 of us. There was one, the one she was already pregnant.
Okay.
There was the younger one, the one who followed me, then me.
Yeah.
So we went back to Nairobi, where she was advised to take me to Bora Road. By then, it was called Bora Road, here at Akamba bus station.
Okay.
That is where our therapy used to be conducted. So she took me back to Bora Road, where I started my therapy. And by then, she could not afford transport home. Already she has left home because my dad said, we cannot stay there.
Yeah.
So she left with me and the younger boy. And we stayed at the streets of Nairobi because we were given 2 appointments per week.
Okay.
We were supposed to go on Tuesday and Thursdays. So she could barely afford even transport. And that time we had Wazungus at Bora Road. They realized that we were not changing clothes. We had become dirty, and they asked why. And my mother told them that we could not be able to go back to our home at Gatundu, and gave the reasons. So we were accommodated at the place.
Okay.
There were servant quarters. She was given one of the room. And we could eat the bread and milk that was being provided by that time.
Yeah.
So it took us some time, and after therapy, we were referred to for assessment. So we went back to Kenyatta, where I got my assessment, and I was referred to Thika, Joytown. So I joined Joytown Primary School in 1978. So I was lucky. I can say I was lucky. By then we had no other special school. That was the only special school for the physically handicapped. So I joined 1978. I went through my education. My dad had no knowledge that I'm in school. He didn't care anyway. So my mom could take me to my grandmother's place so that she could be allowed back at home.
Okay.
So I used to stay with my grandmother.
Yeah.
Yeah.
And you see, it's I mean, the same, and unfortunately, I would say it's the society that we live in, you know, like more or less the same case as Joseph as well, you know, where, you know, baba anasema, ai, sasa hapa, you know, so it's the mom who's left to take care of the child and you know, do all those things alone. And and from the theme again, like we're saying, a healthier future for the mother and the child. So then how do we sensitize people? And Joseph, I think utaongea kwa sababu, you know, on behalf of the men, tunasaidiaje, you know, our dads, our uncles, you know, our brothers, so that wasiache watoto, but wasaidie, you know, the mom to take care of the child. But very quickly, Warimu, do you want to speak on, because clearly it's not, it does not affect families, and especially for, you know, the child just physically, but there's also this emotional aspect of the same, and there's also the financial, you know, economic aspect of the same. And we were talking about this during the break and said, of course, funding is a very big factor when it comes to, I would say anything, really, but since we're focusing on polio today, so then what is that like? Because I know you come into, you know, help as much as you can with the governments and at an international level as well. But when we're talking about funding, what is the biggest gap that you know, you have noticed as an organization, and how then can we improve on the funding so that we do not have cases of, you know, people not having access to vaccines because either they're not there or they're not able to get it?
Well, I think we have to look at it from a partnership and collaboration point of view.
Yeah.
Within Rotary, it is eradicating polio is our biggest program, and we mobilize funds from all Rotarians from all walks of life. And to date, we've contributed, you know, as I mentioned earlier, over $2 billion, because it does take that level of sustained funding and effort to fund the campaigns, make sure it reaches all children in hard to reach places, and also supports the what I would call the parallel activities that need to support that. You know, we've heard that sometimes there's just no food. People need a clean environment. So we come alongside and also support communities with those kind of interventions under our Polio Plus program. So funding is a huge component, and then working with partners who also have the know-how, the strategy to do so. So we are also then able to assist with effective planning to ensure that the vaccines reach everybody, working through the spirit of partnership and collaboration. And therefore every Rotarian is able to feel and be a part of that, to make sure that every child is covered.
That's true.
We're really very, very close to eradicating polio. So every time there's a resurgence, we should all be very concerned about ensuring it does not rear its head, because there is no cure at all. So at the personal level, all mothers and fathers should take the initiative to immunize vaccinate their children, those under 5, and particularly our newborns.
All right. And Lillian, can we just address first of all this whole vaccination aspect? Because like Joseph said, and it's very true, there's some people who don't believe in the same. There's some people who would not want their children to be vaccinated. I know of many years ago, there was also concerns about how many people, or children, to be specific, lost their lives. And this is after being vaccinated. But I wonder if that is still a bigger challenge, or what exactly is the biggest challenge as far as, you know, vaccinating our children against polio?
Let us first recognize that everybody, whether you have a child or not, needs to know the benefits and the importance of getting the polio vaccine. And I don't know why people struggle so much to bring out false information only when we are doing the campaigns to derail the gains of the campaign. We know that there are countries to date, if you have to travel to some countries, for example, if today you are going to India, even as an adult, whether it's one person or 10 people within a family, all of them have to get the vaccine, the polio vaccine, even at adulthood. As Kenya, the expanded program of immunization started strengthening the routine immunization way back in 1978, and you can see the years by. So when Rahab talks about 1971, you can see we had already seen there was an issue, and we had to strengthen our routine immunization. There's a lot of false information and misinterpretation of information. I remember when we were doing the round 2 of the polio campaign this year, there was a TikTok video that was circulating saying that girls in a school in the Western have been given the polio vaccine. They have been injected with the polio vaccine and now they're having issues. We were strictly doing children 5 years and below, and only in Dadaab, in the refugee camp, where we have those cases, that is where we are doing 15 years. Secondly, the polio vaccine we give during campaign is type 2, the one that we are giving currently, and these are drops that are given in the mouth. So it's not an injection. So you have to ascertain whatever you are seeing on social media. The vaccines that we also give in the clinic as a routine vaccine for polio is against type 1 and type 3. So any child who is getting drops in the clinic, they're only getting for type 1, against type 1, and against type 3. For the one that we are currently giving is only type 2, only being given during this campaign. Immediately, like when we finished the campaign at round 2, we stopped giving that vaccine. Even the children who went to get in the clinics, and even the one who will get today, will get type 1 and 3. That is why we say, even if we come to your household and your baby got the vaccine today, which is type 1 and 3, kindly let us also allow the vaccinator to give the type 2.
Yeah, because so many parents will be like, yeah, but my child was vaccinated. Why are we vaccinating?
And we give that information,
it's important,
but I think the way the community gets it, they misinterpret as saying we are giving too many of the same vaccine. Or thinking that we are saying maybe what we gave was not working. It works, but for type 1 and 3. The other issue is that we are having some, not very much like before, but some religious aspect where some religious sects do not allow their congregation to get any medical services. But let them remember that the children are ours, but they belong to the state. So you are going against and violating the child's rights to health, which is also able to land you in a very tight space if legal action was to be taken. Because this is a voiceless child who you are denying services, and if they get polio in the future, it is them who will suffer, not the parent, the guardian, or the caregiver. Then we say that when information for you is not very clear about the campaign, kindly visit the nearest facility and get the right information. We also are having issues with the gated community and with the closed community and with the elite and also from other nationals who come into Kenya. They feel like because they've been given the vaccines that are routine from the countries that they come from, they should not get this. Remember, we have said whatever that we are now fighting is not Kenyan. We didn't identify the Kenyan case. It comes from across the borders. And I said nobody is special. Anybody can get polio.
That's true.
And I know in the 70s, people lost children in a family or got children with disability within one family, maybe not only one. So we don't want to go to that space. And most of all, when the public should understand, if we identify just one case of polio, it is termed an outbreak. Because that one is the one that you are seeing with the signs and symptoms of the paralysis, but
majority are
it is spreading within, and maybe the rest do not show the signs and symptoms. So we normally say for any one identified case, there are more than 200 around them.
That's true, because majority of the cases
and what we should also remember is the polio disease is transmitted by what in scientific terms we call the oral fecal. It is from poor hygiene, poor sanitation, you visit the washroom, you go for a long call, you might not show the signs and symptoms, but you could be having the virus and spreading. And if you don't make sure your hands are clean, wherever else after going for the long call you have touched might contain the virus, and someone else will pick it from there. Let us also look at the safety of the water we take, the food we take, because we know viruses cannot withstand heat. And also, we have seen good evidence during the COVID pandemic that we even washed our hands and the diarrheal cases went down. So with washing hands is also a measure of also minimizing the transmission of polio. So we must look at hygiene. We must look at getting the vaccines at the right time, at the right age. When we are having the campaigns, let us allow the children who are targeted to get the vaccine. And most important, if anybody develops paralysis of the upper or the lower limbs, that is the legs or the hands, maybe they cannot hold, maybe they cannot stand, they cannot walk, and they have been well, and they had no injury or trauma, and they had no illness, but just suddenly they're having paralysis, kindly report that incident to the nearest health facility in less than 24 hours so that we are able to pick the sample and ascertain whether it is polio or it is something else. If it is not polio, they'll still be redirected for more diagnosis, for referrals, and they will be sorted out.
Absolutely, and very important really for people to remember that. Joseph, tumeongea sana as far as, again, the theme itself, inasema a healthier future for mothers and children. But it does not mean ati tunafungia baba zetu, you know, our uncles, our brothers, kando. And over time, ukifanya, you know, sensitization kwa community, have you seen change? And especially when it comes to akina baba in the communities, taking up the role, ya pia kusupport, you know, the mothers na kusupport watoto, and especially tukiongea stories za vaccination. Umeona any change? Is there a difference since the 70s up until now?
Asante sana. Siku hizi unajua wazee ndio wanakuwa front line. Hata wakati tulikuwa kampeni huko Kamkuji, wazee wa nyumba 10 wote hao ndio tuliongoza nao, tukaenda door to door na tulifanya kazi mzuri sana. Kwa hivyo sisemi ati
watu wanajitenga, hapana.
Sisemi ati wanajitenga. Wanajitenga za zile wameona the outcome. Lakini hii kampeni wazee ndio wanajitokeza sana. Sababu tuko na wazee, tuko na vijana, tuko na watoto wa shule ndio tunafanya hiyo kazi nao. Anyway, kazi inaenda vizuri sana. Isipokuwa tu mimi ile kitu ningeomba au foreigners wakikuja, wacha watoto hata kabla hawajatoka wapewe chajo hapo kwa airport ili waache kutusumbua sana, sababu tukienda South Africa ama tukienda wapi, unaona mtu lazima awe na yellow fever. Bila yellow fever huwezi ukapita. Kwa hivyo hata lazima tuweke hizo rules hapa, hata sisi Kenya hapa, sababu unajua watu wengi ukienda huko kwa gated community, wengine wanasema ni foreigners, hao ndio wanatusumbua sana. Lazima tucheje hiyo kitu. Na tupate watu wa kutusaidia vile akina Rotary na WHO wote vile wanaenda wakuje pamoja, alafu tufanye kazi pamoja vile tunafanyaga nao, sababu unajua hakuna siku tumechava ifanya hiyo kazi bila kuwa na wakubwa wanaona challenges vile zinakuaga zote. Kwa hivyo lazima tusaidiane hiyo kazi yote. Kama mimi unajua mimi naendaka kila mahali, unajua nikiitwa mahali pande ile ingine naenda hiyo, nikiitwa hivi naenda hii, nikiitwa hii naenda hii, hata mobilizer za zingine na kuoga mobilizer. Na ninafurahia sana hiyo kazi.
And it's a good thing. It's a good thing kwa sababu through your experience, because despite the challenges zenye, you know, you went through, wewe na mom and your family as well, you're here today and you are part of the Kenya wheelchair basketball community, right? And you're doing so well. And aside from that, again, una volunteer, right? As far as polio is concerned. So you're doing so much, and that's a good thing to see that, listen, at the end of the day, as much much as nilipata polio, it doesn't mean maisha yako inaishia hapo.
Inaishia
And the same
hapo.
thing as rehab as well. You're doing so much as far as sensitizing, the community and all those things. What is it that you would want to see different as far as approach yetu towards polio, either from sensitization, maybe funding, maybe when it comes to vaccination, nini unataka kuona change so that we win this fight against polio based on your interaction with the community?
I think what I should want to say different, especially the issue of immunization.
Okay.
We have had immunization ongoing, routine immunization, and also there is a lot of immunization, especially from COVID. We had immunization on COVID-19. We had immunization on cholera, and we also had immunization sometime back on measles. So I think this should be a continuous process.
Okay.
We should not wait until we have someone or a sample that shows that there's someone with a virus on polio. I want it to be a continuous exercise that should be trained even in our schools.
Okay.
They should know the dangers of polio and how it is contaminated. This is something that I would request our government to ensure.
Okay.
And also when it comes to issue of funding, I've worked closely with Rotary for some time. We did a lot of fund mobilization with them. And these are things we don't get paid for. I always tell people it is a voluntary job. Most of the work that you do for others with disabilities or to help parents who have kids with disability is a voluntary work. But this sensitization really helps because even the mothers who have gone through this are mostly traumatized. You might not understand them. Some have gone even into depression because if you don't have the support of the family, the closest, that is your husband, majority are left on their own to take care of these children. So they need somebody, they need a shoulder that they should cry on. So my request has been that we have these things as a continuous exercise, not to wait until tumesikia imepatikana ndio tunakimbia. This one also for the community to be able to accept us. They should live with us and know that this is polio, it is there. Hatujaimaliza, but we are working towards eradicating polio completely. But because it is here with us, this is how we should handle these cases. Because we have had a lot of refusals. Like when we were doing the first polio campaign round 1, I was called upon in several families where they feel that these things should not be given at this time. Some because of religious issues, and others feeling that it might bring some other effects. There are a lot of myths and misconceptions around polio. So there is a lot of sensitization that is required in the community so that they may understand, because some were saying, serikali haijatuambia kwa nini wanapatia watoto wetu chanjo. So a lot of awareness should be created such that when we come, we don't face the resistance from the community.
From the and that's very important, really. Very, very important. I see that. Okay. So then how do we strengthen this? Because you see, our champions are here to say, listen, we're going to the ground, we're helping people, first of all, to really understand, and based on our story, people need to know that ukipata polio, that is not the end of, end of it. There's so much that you can still do to make sure that you are okay, and this is as an individual and families as well. But when you're talking about a larger scale as far as funding is concerned, how then do we make it sustainable so that it doesn't get to a point hakuna pesa right? And this is as far as fight against polio. So then how do we make this sustainable? And can you do that in like 30 seconds? Because our time is far much spent.
We need to continue working together as partners to mobilize funds. The volunteers that make up Rotary contribute money every single day, every single year towards this. So it is sustainable. And together with our partners, we will ensure that this continues until we eradicate polio.
And then how do we bring in more partners? Because, and what I've seen, and especially when it comes to like government and whatnot, there's that accountability aspect. Right? So then how do we make sure that is there so that when the people who are contributing the money feel that, listen, our money is actually going to a good cause, and in this case, to fight polio or eradicate polio?
A lot of the money that we collect also goes through our Rotary Foundation, which is a trusted foundation, and the Eradication Alliance is also a trusted body. And interviews like this are so important in terms of creating awareness and accountability. So that's why I really must stress the opportunity for partnership and collaboration to make sure sustainability, accountability are built in right from the start. It is possible.
It is possible.
And we will kick out polio.
We will. I really love that. We will kick polio. Okay. 20 seconds, Joseph. In terms of Sisi Wote, as a people, what is it that we can do not only on this day where we're talking about polio, but also the days to come? Nini tunafaa kufanya sisi as a community to really help even those families when you're not talking about polio? Very quickly, 20 seconds. Unajua
kuna vile tunaitagwo mikutano ama tunaitwa seminars. Like county government ikiwa na seminars lazima iite watu, inaitaga stakeholders wote, akina chief, akina nyumba kumi, wote tunaitagwo, tunaelezewa mambo ya hii polio. Kwa hivyo hata tukienda ground wote wanakuwa aware more about this issue. Kwa hivyo hakuna mambo mingi hata inakuwa, sababu seminars zote lazima tuitwe. Na kabla hii program hajaanza lazima waende wakutane na stakeholders wote tukianza hii campaign ili tujue tunaenda pande hii na tunaenda pande hii na tunafurahiaga sana hiyo kazi.
And that's a good thing. Because we're literally being kicked out. So
let us take responsibility, because it will be very sad in the 21st century to have children who have polio just because they did not get vaccinated. So it's an individual, a family, a community, and a national responsibility. And also to add that not only during the campaigns do we give the polio vaccine, the national government and Ministry of Health and other partners like UNICEF, Gavi, and Sabin are supporting the routine immunization. So routine immunization comes first, then the campaigns come in to strengthen what we are doing.
The same. I like that. All right. Thank you so much, Lillian. Lillian Mutua, Nairobi County Head of Health Promotion. Joseph Ndegwa Wangoi, Polio Champion, Nairobi County. We had Werimu Njage, who's the District Governor nominee. Rotary District 9212, like she said, and Rehab Kiraga as well, Kiambu Polio Champion. Thank you so much, really, for your time this morning, and keep up the good work. This is as far as sensitizing the people and also offering support as much as they can as far as understanding polio, and also sisi wote tushikane mikono so that we kick out polio. Okay, so have yourselves a lovely day ahead. See you tomorrow morning, same time, same place, right here on Your World for a different conversation. But today, enjoy the rest of your day. Goodbye.